This audiovisual documents the process of community-based monitoring, a social accountability tool, piloted with the historically excluded Dalit community in 50 remote villages of the Thar Desert. 2,500 households are tracked for access to basic entitlements. Community-based monitoring, a tool for creation of empowered demand for critical public services. Caste and gender-based discrimination and social exclusion are considered the biggest hindrance in poverty reduction efforts in India. Better public service delivery can contribute towards inclusive and sustainable socio-economic development. Public services are critical as they affect the entire life cycle of millions of people, from birth till death, even pre-birth and post-death. National Rural Health Mission visualizes universal access to health and right to education, guarantees universal access to primary education. Anganwadi provides nutrition services to pregnant women and children to prevent malnutrition. Midday meal scheme seeks to reduce student irregularity and dropout besides supplementing their nutrition. Janani Suraksha Yojana aims to reduce mother and child mortality through promotion of institutional deliveries. These acts and schemes have potential for impacting poverty and human development indicators. Huge amount of public money is spent on them, and there are provisions of planning and monitoring at the community level. However, there is public dissatisfaction with its present state. The poor are disillusioned by corruption, lack of responsiveness, and lack of access to basic services. At the ground level, the poor are struggling to make their voice heard. Ordinary living conditions in the Thar Desert are harsh and the region is drought prone. Lack of infrastructure larger distances, and low population density are constraints to accessibility of services. Dalit live in dhanis at the outskirts of the villages. This increases their physical distance from the services. Social and political discrimination worsen the situation.
यहाँ कुछ सुविधा नहीं।
A survey of 3,000 Dalit households in 2010 found that none of the children had been vaccinated in 21% villages. Only 11% of eligible households were receiving social security benefits, and 8% of eligible children received nutritional supplements from the Anganwadi. There is a widow in village, Adagala, who entirely depends on labor in Mahatma Gandhi Narega, pension and sale of goats for her living. 2/3 of her source is government provided safety net. Can we imagine her plight if this net has leaks or is non-functional? There are several similar examples. Community-based monitoring was the answer to sorely felt need for an easy tool in the hands of the Dalit community to help create an empowered demand.